In this video, we're going to start talking about chapter 12, which is the eye. Chapter 12 and 13 are combined into one test because they're both very small chapters. So let's get started on the eye. The eye is the organ of vision. Only a small portion of the eye is actually visible from the exterior. So when we look at a picture of the anatomy of the eye, you can see right here that we're familiar with the parts of the eye that are visible on the surface, such as the iris, the lens, the pupil. But it's actually all of these portions back here, this part of the anatomy, that's responsible for the true vision or the interpretation of what you're seeing through the optic nerve. So here's a picture of the visible surface of the eye. Notice again how small of a portion is visible. The conjunctiva is the white part of the eye, and if you've ever had pink eye, it's called conjunctivitis, which is just an inflammation. We know itis means inflammation of the conjunctiva, which is the white portion of the eye. Okay, so let's go ahead and we're going to skip on down to the combining forms of the eye. Blepharo, conjunctivo, choro, pupillo, corneo, kerато, dacro, lacrimo, irido, iro, oculo, ophthalmo, opto, phaco, retino, sclero. Those are all the combining forms of the eye, and the combining forms commonly used: cryo, diplo, iso, photo, and tono. So remember, whenever we have our quiz, you do need to know the combining forms for the quizzes, as well as our prefixes and suffixes, and we just have a few for this chapter. Our prefixes are bi and bin, bin as in binocular. Suffixes, opia, phobia, plegia. So you can see right here some of the disease and disorder terms built from word parts. Remember, on the test, you will have to know how to put these word parts together. Again, you know, some of the very common ones: blepharitis, you know that the itis means inflammation. Conjunctivitis, we've already talked about. Photophobia, photo means light, phobia, fear, fear of the light. So this is going to have to do with an issue with your eyes and too much light coming in. Let's go ahead and talk a little bit about the disease and disorder terms not built from word parts. You can see right here, here's a good bit of them. Some of the ones that are most common that you're going to need to know are going to be astigmatism. And that's where the surface of the eye is not completely round. It maybe has a little bit of an odd shape to it. So usually they would say people with an astigmatism can't wear contacts or something like that. Well, that's no longer true. They make contacts for everyone now. Cataract. A cataract is going to be a clouding of the lens over the top of the eye. Cataracts can be removed surgically, and that's usually in elderly people that you're going to see cataracts. A detached retina. A detached retina, if you know of anyone who's ever had a detached retina, the back part of the eye is the retina. And if that ever gets detached due to trauma or something like that, it's very important that it gets tended to right away, because that could result in blindness. Glaucoma. People who have too much pressure in the eyeball, you know, like in the eye itself, has glaucoma. Usually they can regulate the pressure within the eye with drops that people put in on their eye. Sometimes it gets to the point where the drops aren't really keeping it at a low enough pressure, and then they'll have to go in and put a little stent or a little tube in to drain it. Glaucoma is hereditary, so if you have someone in your family who has glaucoma, you really should be screened for it as well. Macular degeneration. Macular has to do with the muscle. Presbyopia, myopia, all of these things are going to be covered on the test. Stye. Have any of you ever had a stye? where it's like a little red, looks like inflamed small little bump along the eyelashes. That's what a stye is. It's actually a little infection. Here's a picture of a detached retina. I wanted to show you. Notice the retina. Look up at the top. See how it's nice and evenly attached up at the top? But notice right here, the retina is detached, and that has to do with, sending a signal through the optic nerve to the brain. So it's very important that any kind of trauma that you get your retina checked. Our surgical terms built from word parts. Remember, those will be covered on the test. Some of the surgical terms not built from word parts that you might need to know. LASIK, I'm sure you've all heard of LASIK, and that's where they actually kind of peel the cornea off the top of the eye. And using a laser, a doctor will go in and make slits in the eye to where it corrects for whatever vision abnormality you have, and then they just kind of lay the cornea flap just right back on top. And I mean, there are no stitches or anything like that. Used to be, it was very risky kind of surgery, but now they've done it so many times, it's kind of almost commonplace now. Let's see. This is the actual, see, they just peel the cornea. They open it like a flap, like a little trap door, and they do their surgical procedures there. Notice right here some of our complementary terms built from word parts. Things like binocular, bi meaning two, ocular, so binocular has like two eye openings. Some of these not built from word parts: mydriatic, miotic, optician, optometrist. Those are all going to be things related to the eye as well. Here are some of the abbreviations that you need to know for the test, and that is going to cover chapter 12. I tell you, it was a pretty short chapter. Remember, know your word parts and abbreviations for your quizzes, and know how to put words together for your test. Remember, spelling is also going to be included on the test.